With Dr. Fauci warning we're not there yet on key steps to reopen the economy, we wanted to bring in Dr. Scott Gottlieb, the former commissioner of the FDA, because he's written a roadmap about what it would take to get America back to work. Doctor, thank you.
Thanks.
So is the nation ready yet?
Well, I think we're getting ready. You know, you clearly see a decline in cases. I think that we're heading towards a trajectory that we can start to contemplate potentially reopening aspects of the country in May and into June. But it's going to be a slow process. We want to do it gradually, and we want to evaluate along the way to make sure that as we go back to work, we're not triggering a spike in new cases.
As part of your roadmap, you note that you need the decline in cases, but you also talk about the systems that need to be in place. What are those systems?
Right, you want the ability to broadly test the populations. The other thing you want reserve capacity in the healthcare system. So we need to make sure the healthcare system itself is no longer overwhelmed. And you also want the ability to do what we call contact tracing. Basically, when you identify a positive case, that's the bread and butter, if you will, of public health work in terms of controlling an epidemic.
Then what is the acceptable level of risk that Americans should be able to take in order to return to work?
Well, look, this is an infection that's going to be with us for a long time. We're going to have to learn to live with some element of risk here. And I think we're going to face a bigger risk heading into the fall as we go back to school, as college campuses go back into session. And the fact that this virus probably has a seasonal component to it, it's probably something that is going to have a seasonal aspect where it's going to want to come back.
We started a series this week called Racing to a Cure. And given that a vaccine won't be available until a year to 18 months from now, what do you see as the most promising pre-vaccine treatments that are out there?
Well, there's a number of antivirals that act directly on the virus itself, a handful in advanced development that could potentially be available within the next several months. And so I think if we have by the fall one or more of these antibody drugs available, combined with an antiviral drug that acts directly on the virus to inhibit its replication that can be used early in the course of the disease to prevent people from getting very sick, that kind of medicine cabinet, I think, to be very effective at helping to mitigate the significant risk from this virus. We don't need a magic cure here. We don't need a magic bullet. We don't need something that cures the virus. We can have a therapeutic toolbox that can mitigate the risk of the virus and help prevent spread in certain patients.
Dr. Scott Gottlieb, thank you so much.
Thanks a lot.